Please start recording.
Yes, start recording. And okay, so I'm glad that you are here, and it's very good because we have very good community worldwide. And you know that now we start our free webinars at this time when all of us have to spend much more time at home. It will be more convenient for all of us to have it and to watch it. And we have these webinars 3 times per day for this region. Then we have another one in Russian language, and at night in Moscow time we have it for Europe and for United States. Okay, so and then of course you will be able to see all those webinars on our YouTube channel because it will be recorded and presented, and it's all free. So it's the first from the series of seminars that we plan, and next week at the same time we'll have another seminar for this interpretation of our results. Then in a week we'll have questions and answers so you can make your own questions and send it to us. So it will be ongoing process, and we hope that it will help you to develop and to increase your activity. And of course, if you need to get certificates later on, you can go to workshops, because I hope that at some moment world will be open. Let's hope so. Okay, so let's start. Now let's start from my presentation. Okay, here it is. And now I can slideshow. Okay, so this is about research. As you know, the origin of our technology, our approach, was done by so-named Lichtenberg figures in 18th century. It was scientist, philosopher, thinker, George Lichtenberg, who was the first to develop this approach. So he found that if he places some subject in the electromagnetic field, he can see light around subject. In 19th century, it was many scientists who were studying this effect, like Tesla, like Landon de Moroa in Brazil, Narkevich Yotka in Russia, so many scientists. But then by the beginning of 20th century, it was practically forgotten because there was a lot of turmoil in the society, in science, Röntgen, and then it was practically abandoned. So it was family Kirlian, and you see their picture on the screen, who redeveloped and reintroduced this to the world. Semyon Kirlian was technician, electrical technician, but he was very bright person, very skilled person, and he was able to develop his own approach to this photography. Please turn off your mics, because then, yes, please. Because so if you turn on your mics, then it will be extra noise. So Semyon Kirlian, together with his wife Valentina, spent many years in developing this approach, and they developed named Kirlian Photography. Yes, Kirlian Photography. Still, there are someone's mic is on, so please check your own microphone. So you see, it was interesting, it was beautiful, very nice pictures, but it was just pictures. And it was many papers published in 20th century in different countries. Many scientists was interested in this topic, but still it didn't become scientific. Why? Because for science, we need several main topics. First of all, if we have some effect, if we are demonstrating some effect, this effect should be reproducible. And between just discovering something and a Nobel Prize, it comes maybe 20, 30 years, because scientists are waiting to be any effect reproducible. Then next topic, effect should be repeatable. It means if we are measuring our temperature today, tomorrow, day after tomorrow, week after, we'll have practically same temperature, if we're healthy, of course. And if it deviates, it means some indications of some problems. And the third, the last but not the least, in science, we operate with numbers. Without numbers, it is no science. So Kirlian photography was faint, was very difficult to reproduce, to get same results, and it was very difficult to quantify. It was some attempts to do this, but it was quite difficult. And you can imagine you had to do photo film, to use photo film or photo paper. You need to process this, so it takes quite a lot of time. So that's why in 20th century, 1995, our team was able to develop new device, and the device was named as GDV camera, gas discharge visualization. Now the latest device in this line it is BioWell, but still in the world several companies produce different type of GDV devices. So it was a lot of research done from that time on, and it's ongoing research. So main research lines are as follows. First of all, medicine. It was a lot of research in medicine. And as you know, for many years, we were trying to introduce into medicine. But then we stopped this medical line because it creates a lot of problems for certification. A couple of years ago, we passed all certification for FDA in the United States, Federal Drug Administration. So they offered us class 1 medical device, but class 1 medical device, it means that only medical doctors can use it. And of course, it's not our case, because we are interested that many people use it for their own practices, and main part of our, I would say, community, those are practitioners, doctors of allopathic medicine, allopathic as well, doctors of integrative medicine. So that is why we stopped this process. And now we position our device as not diagnostic device, not for diagnostics, but for analysis. So it is device for analysis of wellness. Still, you can use it in medicine, and a lot of doctors, they use it, but for analysis of energy, of wellness of people. So next topic, those are psychophysiology or even psychology, and we have a lot of data in psychology. Next topic is sport. In sport, we have big line, really big line. In Russian sport, we are using BioWell for all Olympic and Paralympic teams of Russia. It is certified by the Ministry of Sport as one of the key devices for analysis of athletes. And it is included in the line of devices to be used in sport. Next topic, it is the influence of mobile phones. So you can really detect the influence of mobile phones for yourself, and it's important, for example, for 5G, even more than 4G. So I will show you how to do this later. Selection of supplements. Again, it's very important line and very strong line. Consciousness study. It's one of my favorite lines. And again, it's very important for the world to show that consciousness is not just material, and it's not just product of our brain, but it's much more than that. active zones of the world. Here we use Sputnik, of course. And again, we have many interesting results I will show you. Influence to environment, water and different subjects, influence of different devices and water to people, energy conditions of cat. So you see many different lines. And of course, maybe we can find more, but those are the main. And let's discuss about medicine, because in medicine we have a lot of development in different countries, in different research facilities, and it's ongoing research. So we have two papers published on a review of papers on medicine and psychophysiology. First was 10 years from 1998 till 2008. The next one is from 2008 to 2018. And this paper is available. You can find it on our website, eumap.club. I will show you this website later. So here I discuss which paper was published and what was the effect of these papers. So we have different types of research. So first type, those are case reports. This is the type of research. This is articles describing interesting cases. So you can take one person and demonstrate the effect of some treatment before and after. And this is quite acceptable type of research. But of course, it's better to use different type of analysis with clinical data, and then you can send this type of paper to a good peer-reviewed journal, and it may be accepted. Case studies, case series, those are articles reporting more than 2 cases observed in clinical practice. So in previous case reports, it was 1 case, here it was several cases. Cohort studies, it is small studies for developing some protocol, for example, or studies that were defined by pilot studies. They're just testing something. So it is single group interventions. And it's little group. You are measuring this group before and after. And it all should be done under control conditions, of course. So first you are measuring before, then you use some treatment for the group, some influence, for example, meditation for some time, or some treatment, and then you can see effect. Systematic research, it is with good statistical analysis, and it usually takes a long period of time. For example, you can measure effect of meditation before, after, in half an hour, or it's much better if you people use meditation on every day, and you are using effect before and then after, for example, 3 months, and then you can demonstrate effect. But of course, it's much better if you do it as a randomized control trial. So this is most complicated but most precise type of research, where you have 2 groups. First you have cohort of people, and of course statistically you can calculate how many people should be in this cohort. Typically it should be 50 people, but at least 40, not less, because otherwise it doesn't make sense. You can't make statistics on little groups. So that's why you take this group, you are measuring all the people with some technology or several technologies, and then you divide those people to 2 groups in random order. So you just can toss and divide them to 2 groups, or just put their names in the hat and then take one by one. So then one group, it is placebo. Another group, it is experimental. So placebo control group, they have same influence, but without real influence. So in medicine, they are given drugs, tablets, for example, but in reality, it's not a tablet. It is just sugar or just talc or some influence. And experimental group has real influence, real effect, and then you should see effect after some time. So not immediately, but after some time, typically after 1, 2, 3 months. And then you make statistics, you compare all the groups before, after, between the groups, inside the group, and then you can make a lot of statistics. So this is most complicated study, but the most reliable. And we are doing this type of study. I will show you in our laboratories, in our universities. We do this type of studies with big groups of people. Okay, so summary of papers published in the last 10 years. You see, this is clinical studies, randomized clinical studies, the most complicated. It is 16 other types of different studies, and all we have 44. In psychophysiology, we have 30. So that's total, we have 74 studies in 10 years. Again, it's only on medicine and psychophysiology. So it's not included studies on different type of consciousness studies, material studies, so it's different. And interesting, if we compare this with previous 10 years, we see practically same number. So it was 74 in last 10 years and 72 in previous 10 years. So but of course, it's all different institutions, different people, different countries. So it means that it's ongoing research, ongoing interest, but of course with different institutions, different professions. Typically, what's going on? People take GDV or viral, they test it, they see how it works, and then they use it in their everyday research practice. Sometimes they can publish something, sometimes not. So, but it's just every day, and we know this from many colleagues. So, some examples. It was very interesting study, very interesting. Evaluation of potential miscarriage for pregnant women. It was done in the Russian Rostov Institute of Obstetrics and Pediatrics, and it was more than 500 women. And you understand this, all those women was in control conditions, and measurements was taken only from 2 fingers, from ring fingers of both hands, once a day. Then it allowed them to make dynamics and to follow up the dynamics. Because, of course, we understand pregnant women may be in different energy conditions. Some are healthy, some are not healthy, some have these difficult times, mostly in first semesters of pregnancy, some don't. So it all depends. So it doesn't make sense to compare just images or energies. It makes sense to make dynamical study and to follow up their dynamics day by day. Then, if you see drop down of energy, if you see increase of stress, then it may be some dangerous indications. And it was shown with 90% probability that using this approach, it's possible to prevent potential miscarriage. Because you know that it's possible to see potential miscarriage by blood circulation in the womb area with ultrasound, but it is invasive. So, of course, it's with Biowell, you can do it in non-invasive way, only from fingers. It takes 2 seconds, 5 seconds. And of course, if you see something is wrong, something dangerous, then in this case, you can send a lady to a doctor. Or it should work like lights. Green light, everything fine. A yellow light, you should please be careful. Don't go to dancing this night. A red light, please call your doctor. And we take fingers in stress mode, but from time to time, of course, it's recommended one finger mode to see whether it is some potential defects. And of course, from time to time, we can take a full scan as well to see the overall situation. Another research was done in cancer. We have a lot of research in cancer from 99, 98 till practically today. So it was done in different institutions in different countries. And you see some papers published in India, in Germany. Then we have a lot of other papers published in different countries. And it was shown that if we study cancer, we can see statistical difference between healthy people and people with cancer. This is an example of paper done in National Oncology Institute of Georgia in Tbilisi. And it was shown that with this approach, we see statistical difference. So the lower data, it is apparently healthy women, and upper boxes, those are women with breast cancer before and after surgery. So as you see, with cancer, women have higher energy. And it should be like this, because of course we did analysis not of all fingers, but we did analysis of particular sectors related to womb area. And very important, let's pay attention. In inflammation, we have increase of energy. It's our main topic that we always stress. We have any inflammation, we increase temperature, we increase blood pressure, we increase release of immune cells, and it all needs energy. So if people have energy, they can do it. If they don't have energy, enough energy, they can't do it. So immune system strongly depends on energy of the body. It's interrelated topic. Without strong energy, you would never have good immune system. So another research was done in blood, health and cancer blood. Again, it was, statistical difference between blood of samples of healthy people and oncological. And the biggest, of course, research was done in Moscow Medical University by a big group of scientists led by Ekaterina Yakovleva. And mostly they've been studying people with colon neoplasias. Neoplasias, it means not only cancer, but polypus. So they had groups of healthy people. They had group of people with polypus, polypus, and they have people with proved cancer. And you know that what's convenient in colon study, that if you see something suspicious, you can always make colonoscopy and test it with 100% precision. But we understand colonoscopy is quite unpleasant procedure. You need to have several days of preparation. You need anesthesia. Then you need very experienced doctors who do it. So it is clear, even if we recommend colonoscopy every 5 years at least for all people older than 50, then quite few people go there by themselves. With Biowell, you can do it in 10 minutes. And with special program, you can make this analysis. So after first step of the analysis was to see statistical difference between different parameters, both in the whole images of fingers and on different sectors. And they found that different parameters have different inclination. You see, normalized area, inner noise, isoline radius, intensity, those parameters decrease from control group, polypus, and cancer. So they are decreasing. And you see statistical difference very high. And for other parameters, they are increasing. So first group of parameters, they characterize the overall energy, the size of image, amount of photons and their energy. And second group of parameters, they define the curvature of the image, or fractality curvature is same form coefficient. So you see, if you look just to the image, you would never detect that this is cancer. That's why I always tell, please don't try to see cancer. It's a very complicated topic. In my book, The Energy of Health, I discuss this topic in a separate chapter, and I try to persuade you that cancer is so complicated disease. It has so many different types, different stages. So don't try to do anything. And don't be surprised if you see people with cancer who look normal on their bios, because they can use medicine. So that's why after defining all those parameters, they made an equation, and using non-linear mathematics, they were able to create parametric space with all those parameters and define probability of colon cancer. And you see, those are different types of different methods of non-invasive diagnostics of colon cancer. And you see that in these different types, you see different effects. So, with viral, you see quite good sensitivity and specificity. Sensitivity, it means if you take 100 people, then about 80 people, you will make a precise diagnostic from 100 people who have cancer. And specificity, it means from 100 people, you can make 77 people precise, and some people, about 30%, may be wrong diagnostics. But it's not difficult, it's not a problem, because you just, in any case, if you suspect something dangerous, you send people to more precise analysis. And this is a type of equation that was done for this analysis. And you see, it's many different sectors that are included in this analysis. So in principle, it's all based on statistics. Now we have more than 1 million cases in our database. And I need to stress that we don't know who did those cases, because we don't have access to your own database. We just see this as cases. But based on this, we can make statistics. And based on these statistics, we define the range of norm, of optimal zone. We define deviation zones, and we define the where it's possible to have some problem, like cancer. So it's all based on statistics. And so it is clear to use, it's possible to use this. And same approach, same group they've been using for analysis for arterial hypertension. And again, you see very high specificity, sensitivity, but in this case, it was necessary to define females and males. Because in all our research, we define between females and males. We have different physiology. We have different response to everything. That is why it is necessary for research to define for two groups. And it was possible to group according with stage of arterial hypertension, risk of cardiovascular complications. So it was very precise study. And same type of research was done in India for arterial hypertension. They found same effects using neuronal network processing and same precision. Then they did similar type of research for diabetes, again, early stage of diabetes. So as you see, with mathematical approach, it's possible to define problems at early stage. Unfortunately, as I've mentioned, we are unable to present it on big scale, unable, because we are not allowed to indicate some health situations. We can talk about energy, we can talk about the level of stress, about balance, but not about specific disease. But you should know that it exists. So maybe in some countries it would be possible to certify it as medical line for some specific disease. Next topic, as I mentioned, those are sport. And we are supporting and supervising all Russian Olympic and Paralympic teams. And we are measuring only 2 fingers. Because, you know, for athletes, they are very busy. They train very hard every day, several times per day. And they don't have time for long time measurements, even for 10 minutes. They don't like it. Of course, from time to time, professional athletes, they have full medical analysis, and it takes them several days. And I used to be professional athletes, so we had it every year at least. But in everyday activity, analysis should be very fast. So Biowell, it's ideal instrument for this because you can use only 2 fingers. In stress mode, you are measuring energy and stress level. And typically our doctors, our psychologists, they do it when athletes go to breakfast on the way to breakfast hall, and at night when they go to dinner on the way to dinner room. So it's possible. And you see, then we calculate on an energy potential. It is multiplication of energy to stress. It's very easy equation. And you see, it's very clear to see effect. On this graph, you can see one team, a Russian ski and biathlon team, at different stage of training. This is first training camp. When they just came after summer, they came to first training with ski, real ski. And you see energy is increasing step by step. And 1, 2, 3, 4, 5, 6, those are stages of this training preparation. 2 and 3, this is second training camp and moment before competition, when all the team moved to another part of the world very often, and we are measuring them before competition. And you see, those 2 lines, 2 and 3, they are practically same. It means that athletes came to some level of preparation. They are well trained. They have very stable level of stress, and then it didn't change before competition. So it was found that we have very high correlation between this parameter energy potential and their efficiency in competitions. So this is a team of sledge hockey in international tournament in Torino. And you see this one line, it is their performance, and coaches, they calculate performance by their movement, by their goals, by their activity. And second line below, those are the bival measurement. And you see, except of 2 athletes, for all of them, correlation is very high. And it was shown mathematically that correlation is very, very high. So in sport, we recommend you to use this stress test and follow up athletes in time, and then you will have very good effect. You will see it's very easy. So this method of selection of supplements, that's very convenient method, very nice. And this method is based on measuring stress test again. But in one hand, you keep some supplement, you apply it to heart chakra, and you are measuring one finger, and we need to measure ring finger. Then you change your hand and measure another finger. In some places, doctors use some pocket that you put around your neck, and you put some supplements in your pocket. This way you can measure yourself. And then you are measuring different supplements, and then you compare effects. You see in this graph, first measurement, it was done before initially, and we recommend to make it not once but several times to see how stable is it. Then second supplement, it strongly increased stress level, and of course we tell that this is not good for person. Third, green one, it decreased stress level, so it's good. Red one, it had no effect, so it may be good as well if needed, but it's just positive for the body. Body didn't respond to this. Blue one, again, it increased stress level, so we understand that it's not recommended for this particular person. So this way you can test up to 10 different supplements, drugs, and the important that you don't need to swallow them. You don't need to apply it to your body. Just to apply these tablets to your heart chakra. And this approach was developed by Dr. Michael Borkin in United States. He is one of the leading world specialists in endocrinology, and he is using this approach with all his patients, and a lot of other doctors, practitioners, they use this approach. So it's really very good. So it's another example again. So it shows same effect. And now let's go to Sputnik. You see, this is our research map. So we collect this data on our website, sputnik.biowell.com. And you can look at this website and see those different measurements. And every measurement has some description as well. So, of course, we had many types of experiments with Sputnik. Very interesting experiments with distant emission, distant influence. When someone tried to influence data from the distance. And you see how it looks like. So blue bars, those are background measurement for 90 minutes. And then green bars, those are measurements during some influence, intention process. And it was experiment from United States to Russia. We did measurements, many measurements in environment. For example, those are measurements in Cusco, in Peru. And this is very interesting, ancient buildings under the name Sacsayhuaman. And it's pre-Inca construction. Of course, no one knows why what for it was done. It's amazing construction. It looks excellent, fantastic. And you see, we've done many measurements, and we were able to define several areas of different energy in those areas. Then it was repeated measurement in other ancient places. And so all those places not far away from each other, but the level of energy was quite different. So it's not so far away. It's practically same environments. It was same, of course, temperature. It was done one and the same day, but the energy is different. So in Saxon energy was quite stable, very nice. But in other places, it was quite very variable. So because for us, variation of data is very important. And so it shows us that in Saxon entropy was low, but in other places, entropy was quite high. Then it was very interesting measurements done by our friends and colleagues, Adolfo Rodriguez and Marcelo Torres Diaz, who did measurement with some energy resonator. And they started, as all of us do, for several hours, and you see some variations, but what does it mean? No one can understand. But then they start doing for many hours. And you see, so they started from 10, 11 hours, but then they came to idea to put Sputnik in running for 68 hours. And you see, in this long run experiment, they found very precise sinusoidal variation. You see the latest graph. And then they did it for many months. And again, it was very precise variations. You see, it's a little bit different for different amplitude is different, but precision is amazing. So it is absolutely sure, it's absolutely clear that it is some cycle, circadian cycle. And of course, it is related to circadian cycle. And they did many measurements of this type. You see, it is 2018. And in all cases, amplitude was different, but again, it was some cycle. So we see that this is circadian cycle, precise, and some other maybe much bigger cycle that, of course, more difficult to define. And they've done very interesting experiment. They put one Sputnik nearby this active resonator, and another Sputnik was positioned in a room about 200 meters away. And in the beginning, it was blue lines, those are nearby resonator. Yellow lines, those are in the room. And you see in the beginning, in March 2018, it was quite chaotic variations in the room. Then in October, it was more precise. But in January, it was absolutely same as in resonator. So it means that the field of resonator came out from this device and came out to several hundred meters. And those two devices, Bival with Sputnik, they became synchronized. And they start operating in synchronization. So it's very interesting effect. And you know that, of course, we did many experiments of this kind for many days in other places. For example, it's in St. Petersburg. You see we see some variations, but they are not precise. So we don't have precise circadian rhythm here. We did it in Spain, in Costa Brava, for 7 days. And again, it was some variations, but not precise. But here, interesting, we were able to define moon eclipse. You see, it was very interesting effect. But at midnight, sometimes we have peaks of graphs, sometimes we have lower part, so it was no precision at all. But if you want to study some active devices, then of course it's very interesting to have Sputnik running for many days. And in this case, of course, very important to have good power line, because it was known that for some computers, if you are measuring, for example, with Sputnik or just measuring Bival with fingers, with power connected and without power connected on the battery, you may have different results. It is related to the specificity of computers. because we are taking our energy from USB port. And of course, it depends on the power of this USB port. Of course, we have stabilization, but it works to some extent. So when a computer operates without external power, it may change outcome for USB ports. It depends on computer, it depends on USB port itself, but you should keep this in mind. So if you make any type of measurements, any type of experiments, please keep in mind, either you're doing this with connected power, external power, or you should check your batteries. Okay, so this is another example of harmonizer for long-range measurements, and it is special device. And you see this is very interesting effect. So first measurement, upper line, those are Sputnik measurement in a room without harmonizer. And second green line, those are with harmonizer. You see that it's absolutely clear effect. So harmonizer was operating in the room for 1 day, and you see very clear effect. So it is absolutely clear. And so it is again other devices. And now we have a new device, Biowell Element, that is designed to study different subjects. And we are preparing production of this device. Unfortunately, we were totally blocked by this situation with virus. So we were planning to have it on production line in March, but everything is delayed now. So now in China, where we're producing everything, they start operating, but very slowly. So we hope that by summertime we'll have these Biowell elements in production line. Because this is a device, and it looks now is different, with several installations that allow you to study different subjects. And I give you just example. So in QNet company, they produce a special disk that charge water and food samples. And we did very big tests for this. And you see, so we tested this for food samples. And for this, it's important to have samples of the same size. So we use special cutter to cut this from apple. We use from cucumber, it's much easier. And then we are measuring these samples. Of course, not one sample, but many samples. So it was 36 measurement. And you see, this is difference. Control and with food energizer. So we see big difference for apple on area and intensity. For banana, we don't have really big difference on area, but we have big difference on intensity. And of course, when they've been, this energizer was in a refrigerator, effect was much stronger. So this way was, and it's possible to see not only measurements, not only data, but images itself. So initial apple and apple after activator. You see big difference. So same, we can measure water, and we can measure water with water sensor using Biowell, or we have special installation, so same named syringe installation, which allows us to take measurement of water. So again, you see water without any control water and with energizers, different samples, you see. And suspended water drop test, again, big difference. And different images, control water and after activator. Sprouts, we tested sprouts without any influence and with this activator, and we were able to see big difference. So we see big difference in sprouts. So it was proven that it's really effective. Now let's go to randomized control trial. again, so it was one of the latest trial effect of this Kunet disk, water to people. So we had initial test for 40 people, and then they were randomly divided to two groups, 20 people in every group, and they had practically same age range, same gender. And then to every person, to their home, was brought water by one company from Russia, and they had 1 liter of this bottled water per day. So they were drinking same water, 1 liter per day. And the difference was that in experimental group, they put this glass of water on this biodisk for 15 minutes, and then this water had to be structured. And then we repeated this test after 30 days. And it was demonstrated that we have statistically significant difference in different parameters. So in experimental group, we have parameters, increase of blood parameters, and improvement of function of kidneys, and decrease of level of intoxication. We have, so we see it's a really big difference in experimental and control groups. We have change of stress level measured by BioWell. So in the experimental group, this stress level decreased for most of people. And we've been measuring in parallel heart rate variability, and it was demonstrated a really good effect in heart rate variability data. So it was shown that in experimental group, sympathetic activity decreases and parasympathetic activity increases. Same data we had from our balance program in BioWell. So it was very good result. And you see this effect of in control group, all parameters became worse. In experimental group, they became better. And this is change of stress index for experimental and control group. For most of people in experimental group, stress level decreased, while for control group, stress level increased for most of people. And balance, again, for experimental group, for all people, balance increased. For control group, for all people, decreased. So it was very good effect. And finally, I want to show you some data on measuring CLAF. It is our long-range research. It's very interesting, of course, line, very interesting research line. And we are now found that with BioWell, if we are measuring people who are in love, some couples, then we can see that their energy diagrams are very similar. And you can look, it's different examples of couples. And amazingly, their diagrams are very, very similar. And it's even so that those people had been measured very often in different times. So not in one and the same day. And in a couple of cases, husband was measured in 1 year, wife was measured after a couple of years later, but still they had the same effect. So it means, first of all, that our energy is quite stable if we are healthy, if we don't have some severe disease. And our energy diagram is the best representation of this. And second, that people who are in love, they are in some resonance. And diagrams, they demonstrate this type of resonance. So it's absolutely clear resonance between people. So, and then it was done very interesting experiment by our colleagues who've been measuring people who were sending intention of love to their partner. And you see it was like an energy pattern coming from one heart to another heart. It was done in Russia in one of the laboratories. And we can measure 2 fingers, not with Bible mostly, but with some other devices, for example, with Bible element. And then we see that between people who are in love, it's like a bridge, energy bridge. Because for normal people, for normal conditions, they have dividing line between 2 images, because this is a law of physics. So it is indication that love, it's not just imagination, but it's really very, very strong part of our life. And we have to be in love with someone, with each other, with our children, with some other people, and then we'll be able to live long life and be healthy till long life. Okay, so then now I want to show you some, let me see, one more topic. We have this website, eumap.club. EUMAP is International Union of Medical and Applied Biophotography. And here at this website, you see some research section. And this section, you see several hundred papers published on different topics. So you can see here we have books, bioenergy, environment, medicine, minerals, music, plants, psychology, scientific foundations, so many different topics, sport. And of course, they are on different languages as well. So you can find your language, maybe not so many in different languages, because we have most of our papers in English. And then you can choose some category, for example, medicine, you can show research, and then it shows you which paper you have. And then you can press this button view, and you see PDF file of particular paper. And of course, you can download it to your computer. So if you are interested in different research, then it's really recommended for you to go to this website and to see this, how it looks like. So this is what I wanted to tell you today. Of course, now next topic would be to explain you how we can make analysis from our bio data, both from human analysis and Sputnik data, and we'll make it in one of our next webinars. So it will be separate webinar dedicated just to precise bio analysis. It's separate topic, it takes much more time, so that's why we need to have it in separate session. So I hope now you may have some questions, and please send us your questions, because in a week we plan to have session of questions and answers, and both myself and Dmitry will be able to answer all your questions. And next week we have another webinar with Dmitry Orlov, who will be discussing different bio programs and how to use these programs, how to make this interpretation from those programs. Okay, thank you everybody. And now I think that we may finish what we have.
Okay, thank you.